Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Thursday, July 23rd, and this is my daily briefing. To date, we've had 194 cumulative positive cases of COVID-19 in Missoula County. That's up 7 since yesterday. 187 of those cases were identified by testing, and 3 were epi-linked. We've had 138 recoveries and 1 death. 1 Missoula County resident and 4 non-county residents are currently hospitalized in Missoula County, and we currently have 55 active COVID-19 cases with more than 270 close contacts. Active cases and their known contacts are in quarantine and isolation, and they will continue being monitored and supported as needed. The state of Montana is reporting 2,910 cumulative COVID cases, which is up 97 cases since yesterday. There are now 1,280 active cases with 54 active hospitalizations across the state, and there have been 43 deaths related to COVID-19 statewide. First, I want to revisit and clarify the local and statewide face covering mandates. Our local Board of Health unanimously approved a countywide face covering rule 2 weeks ago on July 9th. Our governor implemented a statewide face covering rule 1 week ago on July 15th. In Missoula County, residents and visitors 5 years of age and older are required to wear protective cloth face coverings when inside public settings, as well as in some outdoor settings when safe distancing cannot be maintained per the governor's directive. In Missoula County, our face covering rule is not dependent upon the number of active cases in our county. Face coverings are required in non-public facing spaces of businesses, government offices, and public indoor spaces, except when people can maintain 6 feet or more from other people. There's not an exception in the Missoula County face covering rule for those who are giving a speech or engaging in artistic, musical, theatrical, or cultural performance, provided that the audience is distanced 6 feet away or more from the speaker, and face shields are not an allowable substitute for cloth face coverings. In Missoula County, our face covering rule remains in place until further notice. We, being myself, the Board of Health, the health officer, and other local leadership, continually review local and state information that informs our ongoing safety rules and measures. The local face covering rule and companion health officer order will be reviewed with the Board of Health at least monthly, with ongoing communication throughout each month in between the standing meetings. I've been super grateful to see so much compliance with the face covering rule in our community. I know this is not an easy ask, but it is so important for our health and safety. The face covering helps other folks and reduces the chances of someone unknowingly exposing someone else to COVID-19 when one of those people is either asymptomatic, which is not presenting with any symptoms and doesn't ever present with symptoms, or is pre-symptomatic, which means they're not presenting with symptoms right now, but within the window period of being contagious and will eventually develop symptoms. While we know that the face covering is not 100% effective at eliminating the transmission of COVID-19, we do know that it helps to reduce the transmission. I've seen community members wearing cloth face coverings, and I've seen so many businesses helping with the rule compliance within their organization and public-facing spaces. Tomorrow, our Environmental Health Division is going to present a special daily briefing specific to licensed establishments that will review some of the face covering FAQs, as well as some pro tips for business owners and their staff to continue successfully navigating the face covering rule and compliance within their own environments. Ahead of that special briefing tomorrow, I'd like to review what the health department means when we talk about cloth face coverings. They're just that. They're breathable cloth that fully covers the nose and the mouth, snug fit below the chin, preventing any respiratory droplets from escaping out of the bottom or the sides of the covering. The face coverings that are required are not lace, they're not face shields, they're not coverings with exhalation valves, they are not apiarist or beekeeper coverings. Yes, we've seen those, and they're not medical grade N95 masks or respirators that are best suited to the medical settings for professional healthcare workers that are continuously engaged in patient-client interactions. Every resident and visitor is required to follow the local face covering rule. However, that does not preclude private entities from implementing stricter face covering rules within their establishments. For instance, event organizers for an outdoor event with fewer than 50 people could still require all attendees or participants wear face coverings during that event, which would be stricter than our local rule. A local business may ask patrons to wear cloth face coverings if they are 2 years of age or older, which is also stricter than the local rule, but falls within the CDC guidelines indicating that children under 2 should not wear face coverings. Please continue respecting the local rules as well as the rules within our local establishments. These measures are intended to promote health and safety. These measures also help keep local businesses open by reducing the likelihood of asymptomatic or pre-symptomatic exposure and transmission from patron to patron, or from patron to staff, or staff to patron, or staff to staff. Remember that while wearing the face covering, you should still continue maintaining 6 feet of space or more with whoever you interact with outside of your own household. Avoid people who are sick, and if you're feeling sick, please stay at home. Wash your hands thoroughly and often, and use hand sanitizer when water and soap are not available. So I'd like to wrap up my briefing today with some pretty exciting news. We've secured a lease at the old Garden City warehouse on Flynn Lane for our county testing clinic. The fairgrounds has been an excellent spot for us and for our community during the spring and summer. However, that site doesn't offer the long-term sustainable testing operations that we need to continue serving Missoulians throughout Montana's seasons, from sun to rain, hot, heat, and fire season to ice and snow. So we needed to identify and secure a space that would allow us to be the ability to serve residents year-round while continuing to maintain high safety standards for staff and the public on site. This new facility has plenty of room for everything that we need. There are office spaces for operations staff. There is a warehouse that will be used as the drive-through clinic. We thank the Missoula County Fairgrounds for setting us out on the right foot, and we look forward to transitioning our new operations to 4025 Flynn Lane, which is just off of West Broadway, and we'll be making that move in the coming days. This move will not impact our current testing operations. We don't expect to have any lost testing days. We're hoping to actually begin testing there next Monday afternoon, July 27th. So we look forward to continuing to serve the community and continuing to move forward together. Please mask up and stay safe out there. And that's it for my daily briefing today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so you get notified when additional videos are uploaded. You can get lots of great information on our website at missoula.co/cvirus. You can call 258-INFO for any questions that you might have about COVID-19 or to schedule a test through our drive-through testing facility. And you can follow us on Facebook for lots of great information there under the Missoula City County Health Department Facebook page. So until Monday, everybody, stay safe and healthy out there, and you'll be hearing from our environmental health folks tomorrow.